এতিয়া ইণ্ডিয়াতে চাইছোঁ গ'লে মন লগা বেমাৰ পৰা মৰা কেছেছ বেছি ইনক্ৰিজ হৈ আছে হ'লেবি ডিমাপুৰতে থকা হাৰ্ট পেচেণ্টছ কাৰণে খুচি কপৰ একটা মেদিন্দা হস্পিটেল নিউ দিল্লীৰ পৰা ভিজিটিং ডক্টৰ সিদ্ধাৰ্থ ভাৰ্ষনি তাইতো কাৰ্ডিঅলজিষ্ট আছে কৈছে আৰু তাইৰ লগতে ডেপুটি মেনেজাৰ একটা আহি কিনে আছে ডিমাপুৰতে আৰু DC অফিচ কনফাৰেন্স ৰুম দে ইটো লগা ওপৰতে আৱেৰনেছ কেম্পেইন দিবলৈ আছে কৈছে আৰু ইটো একলা নহয় কিনা কোন ইলাজ ল'ব মন যায় OPD ফ্ৰী ট্ৰিটমেণ্ট দিবলৈ আছে কৈছে আহিবি আমি কাৰণ ইটো লগা ওপৰতে ডিটেইল ৰিপৰ্ট চাই চাব
We are really grateful to you all for taking your time to visit our district to give a talk on health, especially heart. Aji jadi aman taigan taigi naik nase sebulan disi kami respect pura aman PUCCF President pura begana members kan aman President Gambra ini Dimapur dia district kalau jadi Gambra kan jadi kalau invitees awalnya gimana tu matikan nase kalau especially friends from media aji itu acanak program ase taigan be aigana aman especially heart issues aji kali aman sob jani ase heart problem pula itu kan bisi ase itu laga major di taigan pula few hours taigan seminar nisna aru aman laga problem kiba thagile aru especially kumba mano patient kan thagile taigan aigana na bidi ka solve hoina further course of action or treatment begin ga jabo itu nisna taigan abina itu I would like to thank Joint Residential Commissioner Mr. Vinay Kunyak dari New Delhi aman Nagaland House dari break initiate kulina aman itu taigan aise hopefully will be benefited because of their presence and also through their talk on health issues. Before we give time to them, I would like to just felicitate with a slash of our Naga tradition. So may I request Dr. Siddharth and Mr. and also Mr. Uttar Kumar. So after our discussion with them, here hospital, time hospital itu tim panel, especially aman itu Chief Minister Health Insurance Industry panel asyik itu sabra aman tinggi treatment jadi aman itu insurance para cover itu kan asyik itu para amakan will give time to them first, time give time digana after that amakan kita tahu actually or certain issue if we want to clarify itu aman jadi akan time to go. So once again I welcome you all to Dimapur and hopefully this meeting will benefit the public of Dimapur district. Now
So first we obviously patient of the heart disease having some problem, we diagnose them either having heart blockages, artery blockages, or some have issues with their walls, there is leakage, some have issues with the arteries of the neck, and sometimes people are born with some congenital heart disease. So क्या कहते हैं after PCI is the best approach. Initially in earlier days it was used to be the surgery, but now with the help of just needle we are able to completely revascularize the heart and all the blockages we can clear. There is usually no residual stenosis. So once the high risk cases, suppose you have this heart attack and you have low BP, low blood pressure, so early therapy is going to benefit you, and once BP is low we have many resources like IABP and all those things which will help to elevate the BP. So initially we used to stent only one artery or two artery. Nowadays surgeons are refusing many cases because of this old age and all those factors. kidney diseases, diabetes, and blood pressure. So our cardiology basket has evolved really. Nowadays we are using this intravascular ultrasound or the technique. We are just using ultrasound to treat the heart arteries, and we are not making any incision, not doing any surgery. Just with simple needle we can do the imaging of your heart also. So this is the advanced CT machine we are having. It's a 256 slice. So some people are scared and not willing to do angiography because there is a wire going into the heart. With the help of CT scan also we can do angiography nowadays. Just with a small needle angiography can be performed. Suppose you have heart disease, and usually nearby hospitals don't have that much resources. So once the patient reaches, we just check whether the heart muscle is alive or dead. So we have this PET scan with us, which will enable us to know whether the procedure is going to benefit or not. Earlier it was mainly cutting balloon for the heavy calcium vessels. Also surgeons usually refuses such cases. So we have cutting balloon, angel skirt, rotablation. It's a diamond burr which we drill the arteries and to break the calcium. Also high pressure balloons and laser treatment is also nowadays coming up. So we are all doing is just with your either the leg or the radial artery or the hand or wrist artery. With these just simple needle, and we can do all these things. Suppose earlier only option was stent. Nowadays for young patients, especially those who are coming with heart attack, and the young patients are having these heart problems, so we are treating them without stent only. We have medicated balloons for that, and which gives us the stent like results. Also, if the patient is having BP, initially we used to think just to give them some medical therapy. Nowadays, Impella, ECMO, and IVP, balloon pump, and everything are also available with us, which can help us to get some time. This is the hybrid OT and the hybrid cath lab, where in case if our treatment is no intervention treatment is not going to work, immediately surgeon can perform the surgery also. It's a hybrid cath lab and hybrid OT available at Medanta. Suppose some patients don't want that much aggressive surgery because of scar and delayed healing. So we have minimally invasive surgery also, just partial bypass grafting and partial treating other vessels with the stent technology, and hence the optimal results. So nowadays with the use of newer drug therapies, newer assessment, newer imaging techniques, and other therapies like rotablation, calcium drilling, balloon laser catheter therapy, and IVP and Impella, we are able to achieve very good and excellent results in heart patients. Also some patients, this is the major chunk of the patient is of the coronary artery or the blockage. Nowadays patients are coming with the valve problems. So suppose the patient has a tight valve or the leakage in the valve, that can also be treated with the help of a needle therapy like ballooning, TAVI and mitral clip and trick valve procedures. So with the help of just some simple needle we can perform the TAVI procedure. So this was the earlier surgery, and just as you can see with the help of this needle only we are able to do valve replacement. Nowadays patient is not requiring that much open heart surgeries, especially the old age people. So after a day of TAVI or the valve replacement through the needle, the patient is fit and healthy and ready to be discharged as well. So these are the few patients. Next day only they can be discharged. This is a obese gentleman, this is elderly gentleman undergoing valve procedure, which both these patients were refused by surgeons. Suppose you have this surgery done for the valve earlier and the valve has degenerated, we can perform valve in valve also, because a repeated operation will be tricky and risky also. So this again is a mitral clip procedure. You have a leakage in the heart, and that can be treated with the help of simple mitral clip procedure. So also sometimes patient also have the clot formation in the heart, and this clot can go into the brain and cause paralysis. So this can also be treated with the help of needle treatment. This is the device which occlude the clot, and we can prevent the stroke. So every patient deserves the best treatment. More the complexity, more expertise it needs. So we don't just run for the mill procedure. It's a human life. We treat the patient with empathy and care. Complex procedure especially can be performed in nearby in the remote areas of our country. These facilities are not that much freely available. Our structural heart disease program has evolved big time, and it is a great success. Huge success. We are doing the maximum number of procedures in the country, and especially for the wall procedure and stenting and everything.
For any treatment, what are the things that will be covered by CMHIS?
Ma'am, for under the CMHIS scheme, all the facilities are covered for rupees 20 lakh. Till the 20 lakh, all the cases under all the facility it is covered. So for suppose the patient comes in the OPD. And for cardiology, for oncology, they come for the consultation. It will won't be covered under that, but for IPD admission, all the facility will be covered under it.
For OPD patient, but for inpatient again it will be?
It is on the hospital rate, but once the patient got admitted, they will be treated under CMHIS.
So like their stay will be, if they are admitted to hospital, then their stay will be covered?
The stay will be covered completely.
Then the surgery cost will be covered?
Surgery will be covered.
In case surgery happens?
Yes, sir.
Then the medicines?
The medicine, if the patient come under the admission, the medicine cost will also
Everything will be covered if patient is admitted, not on OPD basis.
So if a patient comes in case and produce the card, is there any procedure that has to be done before these things are done, or we just have to produce the card and then we'll go for the treatment?
First, the patient will come for a OPD. Once the patient is advised for an admission, IPD admission, we have a platinum desk counter specifically for Nagaland people. So they will report to that department, and their card will be validated through the portal.
Sir, you mean to say there's a special department for people of Nagaland there?
We have specifically
the
platinum desk we have specifically designed for you, ma'am, for Nagaland.
So who is the contact person there? If you can kindly
Ma'am,
share.
actually I am the contact person for.
Then you have to share your number with everyone.
Yes, I'll say that. I'll say that. So I am looking after this government of Nagaland, and I am coordinating all the patients of government of Nagaland. Those people whosoever is coming to our hospital, they are contacting me and we are helping them. So this is the procedure.
So what about Ayushman card? Do you take patients for Ayushman card also?
Yes, ma'am. Ayushman card we also have.
Thank you.
Ayushman not on emergency, only for elective procedures.
Excuse me. Just in continuation, for CMHIS, we have two categories. That is government employees with 20 lakh coverage, and then one for the general public, which is 5 lakhs.
5 lakhs.
So both your services are available to both.
Both
the
we are serving. We are doing for both the people, ma'am.
Okay.
For the government employees also, and for the normal people also.
Okay,
For
so
the
it's
normal people, it
applicable-
is for the cardiology services only. For admission.
So
we have
for the
it-
normal card, it's just for the
Cardiology.
right now.
Yes.
Okay. And does it also it doesn't mean that they have to be admitted only in the general ward, or even if they cover the private rooms, will they still be considered? Because some hospitals have certain criteria. So how does it work for the general card?
For the general card,
For the 5 lakh coverage.
For 5 lakh coverage, we the patient admitted under semi-private ward, ma'am.
Semi-private ward.
The government has a rule: if the patient come for the Ayushman Bharat, they will be admitted under semi-private ward. And those who are there is criteria. I think the bed criteria is there for the everybody. But for the normal people, I think the semi-private ward is there.
Okay. Because some hospitals give the option like their coverage will be from semi-private, but they can have they can opt for a room that is
Higher
expensive,
category.
but then they can be charged over an extra for your
the difference
that portion.
amount will
So
be-
that kind of
we
facility is
do
also
that.
available, right?
Yes.
Okay. Thank you so much.
Can you kindly tell the public the surgery rate, the cost?
Sir, in the cardiology, we do the angioplasty we do, and that cost around 90,000 for the surgery, and for the shunt cost is 23,650 rupees. So there is a CGHS plus some rates have been more there, so it will cost you around 2 lakh rupees for the angioplasty, and that will be bear by the government, not you have to pay.
CGHS rates are applicable.
CGHS rates are
actually.
applicable
All
for the-
those surgery which are CGHS rates.
CGHS rate, which is for the normal hospital rate, it is like 1/5 of the total 1/5 loan rate. The government has devised a rate which is 1/5 of the your hospital tariff.
So since our cardiologist is also here, doctor is also here, can you please share some tips how to keep our heart healthy, especially for our older generation, or maybe now from 30 plus onwards, people are having a lot of heart problems. So if you can share a little bit of tips
In
which
general,
we can incorporate in our lifestyle.
in general, basically we can control our eating habits. So we have to restrict our salt. Try not to take sugar at all, especially the white sugar. You are supposed not to take even a pinch of it. Also, oil and all those things you can have, but restrict them. Try not to reheat the oil. Oil preference depend upon you, whether you want to eat coconut oil or mustard oil, whatever. Just try not to reheat it again and again, so it loses the property, and the reheated oil is actually the one which gets deposited. And same with the sugar, it is ultimately going to convert into fat and get deposited, especially in the abdomen. So, and regarding physical activity, everyone is supposed to be physically active. Try to walk at least 30 minutes a day. ठीक है, apart from your routine walk, so people say कि है ना, we are walking daily on routine basis, so separate 30 minutes or 40 minutes, just simple walking, which will increase the heart rate. That's it. You are supposed to increase your heart rate. And especially young people who are do not smoke. So smoking is the leading cause of this heart attack in young patients, especially who are below 40-year-old age. And also in Indian patients, is mainly related to stress, which is obviously something which cannot be avoided that much. So try to take life with ease actually. So just simplify your life, that's all.
I'm asking too many questions, but thank you, sir. Just one more question. People say that olive oil is better than the other oils.
Yeah, I am also
there
saying the
even
same.
for that also, because now in the market what we get is mostly soybean oil. Other oils are a little expensive, more expensive than soybean. So commonly people use soybean, that also refined oil. So sir, how harmful it is, and if we opt for different oil, is it more healthier? I just wanted to know.
So what what data suggests, actually what research suggests, is try to basically shuffle between the oil. One time you bring home coconut, one time mustard, one time soybean oil, one time olive oil. Olive oil definitely is very costlier, and it is just fancy thing for marketing purposes, but not going to benefit. Main thing is, if you even reheat any oil, it will lose its characteristic. And oil is very essential for obviously mainly fat cells and everything. Neurons rejuvenate, and for a healthy life, oil is also essential. You cannot remove completely oil from the diet.
Do you have any suggestions on how a normal person can identify between chest pain and impending heart attack, and what is the first line of action we as first responders can have within the first 15 to 30 minutes before reaching the hospital?
So typical chest pain will be initially, suppose blockage is going to start. So once the patient will start feeling chest pain on exertion, mainly on walking or when he try to run. Gradually this distance gradually reduces. Suppose initially if the patient is getting chest pain while climbing stairs, so he should report immediately, and it means the blockage has started. Gradually it is going to walking distance or physical activity is going to reduce. Once the plaque rupture actually, then the patient suddenly develop this heart attack. So the typical chest pain will be in the center of the chest and radiating to either of your arm to your jaws. Sometimes people feel only jaw pain, sometimes only. The classical will be on walking. That is the stable angina. That means blockages has been there for quite some time. So once the plaque ruptures and platelet and everything comes and goes, so patient will have pain at the rest. So heart attack, how will it occur? Patient will have profuse pain and sweating will be there, excessive cold sweating will be there, and the pain is going to persist for almost half an hour or so. This walking pain, once the patient relaxes, it is going to subside. So if the patient is having heart attack, it is going to persist, and after half an hour immediately ECG changes will start to develop. So pain sometimes, especially diabetes patient has got angina equivalent or the chest pain equivalent. They will feel dyspnea or maybe diaphoresis or maybe palpitation, यानी कि घबराहट undue unnecessary घबराहट is also the sign of, especially in diabetes. So cardiac arrest is something terminal event. The patient is immediately going to die and the heart is abruptly, it was beating, now it has stopped. So once you massage it, so it is going to revive. So we are trying to, basically with CPR, what we are trying to do, we are trying to beat the heart manually, and so the blood is going to, blood whatever coming is going to pump, and your end organs like kidney, liver, brain and everything is going to function for that till the we pray that whatever event has caused a heart attack, it got reversed. Sometimes heart activity comes. So cardiac arrest mainly occur because of arrhythmia also and many other things. Suppose there is some problem with the lung, then also cardiac arrest can occur. Heart attack is the basically there are three arteries, one of them get blocked, so the only a part of the heart is going to be affected and the rest of the part is going to contract or the function properly. So it gives us some time. So that patient will have low BP actually, rather than having immediately crashing rather than crashing.
Sir is saying that the patient in the cardiac arrest will be completely unresponsive, but in the heart attack the patient will be talking to somebody that I am having a chest pain and I need help. But in the cardiac arrest the patient will completely be fainted, and in that case he requires CPR. So various CPR also we give the training to the masses and among the people. That need also to be done. We do that training also. So that training
Can we do it online also, sir?
online we can give you, ma'am. On the reaching the hospital we can give you that online CPR training, in which once the patient is fainted, what we supposed to do, that we can give. CPR we can give. CPR training we will give. That is
Actually, not everybody knows how to do CPR.
The training we will give, ma'am. If you give us a date now, we will finalize a date, and for a half an hour for the common people, for all you will do the CPR training.
तो प्रोग्राम तो खत्म हुए डॉक्टर सिद्धार्थ वार्षने कार्डियोलॉजिस्ट मेडिंडा हॉस्पिटल गुरुग्राम ताइब्रा पावर पॉइंट एक्सप्लेनेशन दिसे और मानुखान हार्ट अटैक और कार्डियक अरेस्ट इतो मोस्ट ऑफ द टाइम डिमापुर और नागालैंड मानुखान इतो कमनली यूज करे होले भी ताइब्रा कैसे इतो अलग अलग आसे और हार्ट अटैक जुदी मानु हुइसे गले पाराताक हॉस्पिटल दे लुई निजा कि दे एस्प्रिन नइले डेस्प्रिन दो खाबले लागे चिउ करबले दिबि गय आसे एंड इतो पासते हे नियरेस्ट हॉस्पिटल दे लुई जाबि इनिया गय आसे आरो इन द केस ऑफ कार्डियक अरेस्ट तादि दो पारादाक सीपीआर मारिबि गय आसे आरो इतो पासते आमी खान नियरेस्ट हॉस्पिटल दे लुई जाबो पारे गय आसे आरो जुनतो ताकान मिडिंडा हॉस्पिटल इतो गुरुग्राम दे आसे इतो Nagaland de thaka manukan tati jabu monja shikule 25 kilometers away from railway station New Delhi aro 15 kilometers away from airport aro most important part to itu heart surgery kan lui shikule expenditure to pishi tambin hoi ko ase starting from 90,000 onwards to 2 lakhs aro juntu Medanta hospital ase takan Nagaland laga package jindo CMHIS scheme ase general scheme aro government employees pensioner scheme itu sob takan loi goi ase aro itu ekla noi kina Ayushman card users kan bi itu applicable hobo koina koi ase so amigan Nagaland dibi heart patients kan young age youth kan logo dibi bishi common hoi ase aro itu noina older age kan bi itu heart laga problem sickness bishi ulai ase so Medanta hospital bra koi ase ki apuni kan judi aishe gule tate CMHIS jindo chief minister health insurance scheme digina ase both general aro employees aro pensioners kan dubi itu applicable hobo impanel hoigina apuni la expenditure sob to itu jabo koi ase hoilebi apuni kan rooms kan lobo gole AC kan loishe gole itu to alak alak jabo koi ase at the same time Ayushman card laga dibe judi apuni kan Ayushman card holders ase gole itu to ward te admit kuribo lagi koi ase so amikan jindo Medanta hospital Gurugram bra takan doctor aro public relation aishe takan bra koi sabte takan contact numbers bi dishe apuni kan contact kuribo paribo aro judi apuni Nagaland laga ase kone takan ki koi dishe gole Nagaland laga itu benefits medical benefits kiman ase itu sob applicable hobo koi ase so amikan akha kori thakibo ki aji laga itu seminar aro jindo OPD kunba public kan treatment lo ase itu amikan dikhabo na pare holibi apuni kan aji laga medical camp te attend kuro parnai khulibi apuni kan jundu contact number dia ase tade contact kurigina doctor logot consultation kurna New Delhi dibi jabo paribo guna itu bi janai dia ase itia korni mani for more updates apuna side global window